Hi, my name is Gabby, and today we're going to be doing an assessment video. Today we're going to be doing Justine's TMJ joint. So we're only going to be doing the active range of motion, measurements, and then I'll just talk about the resisted range of motion. So of course, first we're going to begin with the rule outs. So what I'm going to have Justine do, I'm going to have Justine look up to the ceiling. Any pain there?
No.
Cast upward pressure?
Mm-hmm.
Any pain?
No.
Okay, and then I'm going to have you look down. Any pain?
No.
Cast the pressure?
Mm-hmm.
Any pain?
No.
Okay, so for joint below ruled out, we don't rule out any joints above because there are no joints above. So now we're going to begin with active range of motion. So what I'm going to have Justine do is I'm going to have her open her mouth. Okay, and then close it. And then from here, I'm going to have you kind of mock an underbite, so protrude. Okay, and then retrude. And then from here, I'm going to have you open slightly, and then deviate to one side, and to the other side. Okay. So that would be active range of motion of the TMJ. Any pain?
No.
Okay, so there's no pain. Now we move on with measurements. So you can use a tape measure or a goniometer. The important part here is to not have contact. The goniometer should not have contact with the person's lips. You're just kind of eyeing it just for hygiene purposes. So the only ones we're going to measure is we're going to measure opening of the mouth, we're going to be measuring protrusion, and then we're also going to be measuring the lateral deviations. So your mark here is going to be the bottom of your top teeth, and then you're going to measure between that and then the top of your bottom teeth for opening of the mouth or depressing the jaw. So here I'm going to have you kind of smile a little bit so I can see your top teeth. Okay, I'm going to have you open. Okay, and Justine got 4.5 centimeters. The norm is 3.5 to 7 centimeters for opening, 5 centimeters for opening of the mouth. So let me just reconfirm, 3.5 centimeters to 5 centimeters of opening of the mouth. Next, what we're going to do is we're going to have Justine kind of do an underbite motion like we were doing before. So the protrusion of the jaw. I'm just going to kind of goniometer straight here. Okay. So your point here, you're measuring from, again, the top teeth, the bottom portion of it, and then you're going to see in relation how the bottom teeth move, and you're going to measure the distance between those two sets of teeth there. So I'm going to have you kind of do a smile for me so I can see. Okay, now I'm going to have you protrude your jaw. Okay, so Justine got 10 millimeters there, and that is within normal range. Next, what we're going to be doing is we're going to be doing lateral deviation. So you're going to be doing, your landmarks here is going to be the midpoint of your two front teeth and the midpoint of your two bottom teeth. If your patient has uneven teeth, you just kind of have to eye it where it should be. But Justine has really straight teeth, so I'm not really too worried about that. So again, we're going to be doing left, and then we're going to also be doing right. And then there's not too much movement here. The normal value here is 10 to like 15 millimeters, so it's really not much. Okay. Here. Okay. Can you deviate to the other side? Justine got 8 millimeters, and now I'm going to just flip it over and smile for me. And do the other side. Okay. And she got 8 millimeters on that side too. So again, that is within normal range. For resistor range of motion, I'm not going to do it on Justine. She's not comfortable doing resistor range of motion. What you would do for resistor range of motion, if you want to have her close the jaw, you can either do it with gloves or hold the chin down. And if you want to do opening of the jaw, you just hold it here and have her do it against resistance. And then with lateral deviation, you can just have your hand here and then have her deviate this way and this way against resistance. And then with protrusion, we don't really measure resistance with protrusion, but if you really wanted to, you could by potentially putting it here and having her go against resistance, trying to form that underbite. The TMJ joint is a joint that gets aggravated very easily, so like Justine's joint, so that's why she omits the part of doing the resistant range of motion. And yeah, that's just the precautions that you have to take with the TMJ joint. And that would be the assessment of the TMJ joint.